Well, 6 former members of Biden's transition COVID advisory team are now suggesting that many say we should have followed all along this advice: live with COVID. Those doctors wrote in the Journal of American Medical Association, the goal for the new normal with COVID-19 does not include eradication or elimination. It should be recognizing that COVID is but one of several circulating respiratory viruses. Dr. Marty Makary, Fox News contributor and professor at Johns Hopkins University School of Medicine, is in focus now. Doctor, always great to have you on the program. So shutting down the virus, you told us months ago, maybe even years ago, you can't do that like you just can't do it with anything else, but you can work to contain it.
Well, that's right. And it's been very hard to get through to President Biden. You know, he's got medical advisors, but they're like-minded, and they're, quite frankly, out of step, I think, with the rest of the medical community. Many of us have tried to get other points of view into the White House. And here you are seeing a group of Democrat political appointees, that is, those who are considered loyal to the Democrat medical establishment, like Dr. Zeke Emanuel, basically defect now and go around the guidance, go around the channels through Dr. Fauci, and write in our top medical journals that we need an entirely new approach, one that's based on common sense.
It's interesting. As you were talking, I wrote down the word sycophants. Because not only do they all agree with each other, these advisors, there are some politics at play, too, and who doesn't want to be in the president's popular circle, I suppose. They should look at his poll numbers. The awful saga continues in Chicago, Illinois, Dr. Makary. Classes there have been canceled for a 3rd day as the teachers union there continues to defy city officials, pushing to get children back in school. So the mayor wants this now. And that fight is heating up in other school districts now, leaving more parents in the lurch. In Oakland, California, for example, a group of teachers reportedly planned a sick-out for today, some of them telling local affiliates that they won't march themselves into a death trap. In San Francisco, unions in the school district failed to reach an agreement on a testing plan that teachers have been demanding. The president of the United Educators of San Francisco says they want kids in school, but nothing is off the table. Take a look.
This is a school district that's basically been shrugging shoulders and acting like COVID testing and prevention isn't important. If safe working conditions are not met, then it's very possible people are working in conditions that are unsafe, and that is not okay.
Dr. Makary, a death trap in classrooms for children, and you say what to that?
Well, look, that rhetoric is very damaging because what it does is it looks only at viral replication and it does not consider mental health. And people are dying from mental health problems. And that's something that where if you want to construct an argument that the environment is unsafe, you can always do it looking very focally at only one organ system. If you look at the totality of harm, it is clearly there. Developmental, suicide, we've seen mental health worsen among 31% of kids, according to a study, a mental health crisis. So you can always construct a medical argument around the eternal excuse of an environment being unsafe. But if that's the case, then the kids should not be in automobiles, which account for more deaths than COVID-19 over the last 2 years.
Look, these teachers' unions say that they're looking at the science. If you could communicate directly to them, what would you tell them about that?
Look, we are imposing harsh policies on a defenseless population. Ask them, ask the children, ask them what their risk tolerance is, because there has never been a documented case of a healthy child in the United States dying of COVID. And for kids with a comorbidity, their risk is equal to influenza, and they can get vaccinated or take other precautions. So if we're going to do this now, we're going to have to do it forever, because influenza is not going away, and 10 to 25% of kids will develop a respiratory infection every year with similar outcomes.
Look, just a year ago, last summer, when we started to open up and people were getting on planes, they were telling grandparents, look, when you're around your little ones, RSV is very real. We had on masks, and then we were taking them off in the warmer months, and little ones can get that particularly troublesome and deadly respiratory disease. Just your quick thought on that.
Yeah. Well, you know, what we're seeing with COVID is such a stigmatized virus at the exclusion of all other respiratory pathogens. We saw it with HIV. Remember when parents said, I'm not going to let my kid go to school where there's a child with HIV, even though the science didn't support any human-to-human transmission in a classroom. We're seeing that highly stigmatized politicalization right now with COVID.
Wow. I want to get to this. Moderna's CEO says people may need another booster. And that would be like 4 shots total by this fall and maybe beyond. He says waiting for the data in the coming weeks on how long boosters last is what we should do, and says he does not expect the news to be great. Dr. Makary, you're firing back at the FDA for posting a video that argues even people who've been vaccinated and got COVID, giving them natural immunity, still should get these boosters. You suggested that that is misinformation. Here's what you tweeted. This is so disappointing to see. It's extremely misleading. Many government doctors have lost their scientific objectivity and sadly ignore the overwhelming data of natural immunity. Dr. Makary, your argument.
Well, look, natural immunity has now been studied in over 100 studies, and all the more research in the world is not going to convince public health officials who are politically appointed and loyal scientists who have lost their objectivity. Look at how the FDA bypassed their expert panel just to get boosters approved for young people. This is no longer a scientific authority organization. Natural immunity is real. And when we talk about mandates, as the court is considering, you know, they don't do mandates very well. They ignored natural immunity. The dosing between intervals was not optimal, and the boosters in young kids is not supported with any data. Same with some of the other mandates.
Real quickly, if you have had COVID, you've been vaccinated, can you still get a booster if you're in one of those high-risk categories, or do you have to wait a period of time?
There's no need for a booster. Your natural immunity and vaccinated immunity is hybrid immunity. That's the best immunity you can get. Many people around the world need to get vaccinated. Those doses should be going to them.
All right, Dr. Makary, let's do some breaking news now. We've been keeping our eye on that Dr. Walensky solo, rare for her, she's usually in the big task force group, talk today and update by phone. A lot of questions about the revised CDC guidelines telling people who test positive for COVID to isolate for 5 days now instead of the previous 10. And so she's getting hit with this. And just now, Dr. Walensky said this.
If on day 5 you don't have symptoms anymore, then we can talk about coming out of isolation with a mask on, strictly masking for those remaining 5 days.
First of all, your initial reaction.
Well, I think the bigger problem is not what the CDC is saying. It's the fact that we have this intense dependency on the CDC to adjudicate on every aspect of American life. The CDC also says that people should not eat meat medium rare. They've said that for a long time. We've got to get away from this intense dependency and recognize that they're not going to land the plane with a soft landing. They could take off and put a lot of restrictions in place, but they don't have good off-ramp criteria. We got to turn to common sense.
Real quickly, so when she says, well, we'll talk about it, who does she envision we're talking to when we reach that 5-day point? We have to figure out if it's time to test, go back to work, go back to school. Who does she think we're talking to? She didn't say doctors.
The pollsters. Yeah, look, I think they're talking to pollsters probably. They're trying to sense public sentiment, and that's why they leak recommendations to the media before they announce them.
Dr. Makary, in Focus today, thank you very much for your time and expertise.
Thanks.